Hey guys, so I want to show you something that I didn't get time to do in class because we didn't have class this week. If you're watching this in the Monday class, or if you're in the Monday class, I probably showed you this in class after the guest presentation or whatever. But of course, you Wednesday people weren't there. So I'm going to show you this really as quickly as I can because I think it's the most important thing in addition to the lecture that we didn't get to cover and discuss this week. So if we need to bring it up next week, we can totally do that. Just let me know if you have questions about it. So one of the big things that I hear from people in the field regarding whether we should or should not perform assessments, and it's sort of related to your comfort level in assessment, is how well am I trained and what authority do I have? A lot of us think that we've been trained, so we should be able to use these tools. Others are like, well, I don't really know what I'm doing, so I don't feel confident or comfortable. And that seems like an ethical problem. So I can't really deal with the ethical problem and the comfort thing unless we talk about that. So I'm going to save that for a different time. But I can tell you about what your legal authority is to use this stuff and some of the consideration I've taken into account when I've taken this class and the questions that tend to come up when you're in practice and other people challenge you about what you can and can't do. So I don't recall if it was this lecture or the one that I recorded for next week's lecture, but when we're talking about the history, there's been some contention in the past about what counselors can do, particularly between psychologists and counselors psychologists are all trained at the doctoral level. Well, that's changing now because they're some stuff I don't need to worry about right now, but they've all been trained at the doctoral level. They've had a real strong background in statistics and scientific methods and that kind of stuff, whereas counselors tend to focus more on the humanistic parts of the therapeutic relationship. There's just some subtle differences there, but psychologists look at that and say, well, you don't really understand the tests as well as we do, and we don't want you hurting people in the process by using them inappropriately, so we should restrict your use of them because it's just not a good thing. That comes from a good place, but it also creates some discord between the two professions. Counselors often think, well, we are trained and capable of doing this in a way that most other treating providers are, so we should be able to use them. So that's led to the requirement of putting some rules in place. Some of them are laws, some of them are rules. So I want to explain a little bit of that and how I've structured that in Canvas and in the syllabus, so you kind of know what this information is that I'm showing you. So let me pull up the syllabus and start there. Right here in the syllabus, there are two links right above my head here. And the first one is a link to the state law that has been put into law, like literally passed by the legislation of Wisconsin. A lot of states have these, not every single state has them, but most of them do, I think. And that I will show you right here, this one here. So I'm not going to read this entire thing. It's super tiny. You can go look at the language here, but essentially what that does is it says two things. One, we, the state of Wisconsin and all of its constituents and representatives making the laws and policies and that kind of thing, say there needs to be some limit to what you can do and we need to give some authority, but we also need to put some limits in place. Okay, so that's the laws. The representatives, I think wisely, say, but we don't really understand counseling and we're not psychologists, and so we don't really know what the right thing to do is. We just want to make sure that you have the ability to do the things that you should be doing, and there are some limits put in place on the things you shouldn't be doing. With that said, we're going to leave it up to the Department of State or the Secretary of State and the labor market stuff, which is where the licensing boards live, both the Psychology Licensing Board and the Counseling, Social Work, and Marriage and Family Licensing Board. And the state gives the authority to these professionals who sit on the board to make decisions about what's right and what's not right. Okay, so that's all this does. It says there's got to be some limits, and we're going to give authority to this other group of people to make those limits. Okay, that's what the law is. Sometimes we use the wrong word to describe what we're actually talking about here. So, I'm just looking here to see if there's anything that I actually want to say about this, and I don't think so. It basically says follow the guidelines, and you can't do testing unless you follow those guidelines, and that's what I'm going to show you now. Okay. On the syllabus, this other link is what we call the administrative rules. In other words, when the legislature gives the Secretary of State and all the labor industry licensing boards underneath that the authority to make decisions for what's good for their own professions, they call those the administrative rules, not laws. Okay, so I'm going to show you what those rules are. That's what this is. By the way, if you've had ethics with me, you've seen this. If you've had other classes, you've probably seen this, because this is where there's the rules about how many hours you have to get, how much continuing education you should be getting, how much fees you pay for your license, like all of that stuff, all the details of how to administer this program to the state. That's all there. And so later on, you're going to have questions, which is why I talk about this over and over again in different places, because I think giving you the information of where to go to find out this information is really helpful. It's really obnoxious reading it because it's not fun reading the legalese, but knowing where your information is a great place to start, at least to inform yourselves. So let's take a look at this link. In Wisconsin, they're all pulled up as a PDF. Other states don't do that. They just put them on the website, but here they're PDFs and they look like this. So, please zoom in. There we go. That's a little better. Get rid of those. Okay. So this section about psychometric testing, that's what's relevant to us. I already kind of highlighted some things, so we're going to skip forward just a little bit. The requirements for performing psychometric testing, that's what this part is. And I'm going to skip down. You can read this if you want to, but it just says like you have to accurately administer, score, and interpret the test. Of course, we kind of know that. Independently select administered tests, like you have to be able to do that stuff. So as I've been setting up the class, that's kind of what I've been thinking about. How do I prepare you for that? Let's go down here. Licenses authorized to perform psychometric testing. Here is us, a license or, oops. Here is us, a licensed or trained licensed professional counselor. So we are allowed to, according to these rules, okay? The other part to that is down here. I didn't highlight this, but I'm going to. If we are acting under the supervision of another license of the board specified in paragraph C, which is somebody else who's licensed. So if we're a trainee, we can do that. So that's what this is about. So if you have a license or a trainee license, you're able to do this. Now, in order to get those licenses, you have to be able to do pass certain classes and have certain education. This kind of expands what that is. So for the specific psychometric testing, you have to be able to understand descriptive statistics. And notice it doesn't say perform the math and do all that kind of stuff. It says you have to be trained in this, which is what I'm doing. I'm still training you in it, even if it's about just consuming it and making good clinical decisions. So descriptive stats, we'll cover that. Reliability and measurement error, we'll cover that in the stats thing. Very nice. The thing is our little subunit on stats in a couple weeks. Validity and meaning of test scores, we'll cover that. Selection of tests, test administration procedures, we're doing that kind of right now in our discussion. Diversity stuff, ethnic, racial, cultural, gender, age, linguistic variables, and how that affects test outcomes, that kind of stuff. And then testing individuals' disabilities. And then here's another part too. It's slightly different, but it's kind of the same thing. License is qualified to supervise psychometric testing. So as a supervisor, it's just, saying that you can do that too. So that's kind of it. It doesn't seem like a whole lot, but it does a couple things. One, it gives some of you who are worried about, can I actually do this? Is it ethical? Well, ethical is another question, which is worth discussion, but legal, yes, you have the capacity to do these things. For those of you that are like, I should be able to, here's your explanation of what gives you the legal authority to do this stuff, right? So I just wanted to show you that. I'm not going to talk about it anymore. And outside of, I'll probably don't need to mention it in class unless you have other questions about it, but I think it's helpful for one, just to show you how to get to this stuff and where it lives and kind of how to find answers to these kind of questions, especially as people say you shouldn't be doing this or you should be doing this. So kind of nice to see just behind the curtain a little bit on how why we're doing certain things in classes and how that fits into the profession of counseling. So we can talk more about how that shows up later in the actual field of practice when things get challenging and difficult. But that's probably a discussion for the ethics class and not this one. But we can certainly do that if you want to. So let me know if you do. And I will see you next week. Bye.